On February the 1st this year, around 80,000 members of staff potentially face the sack in NHS England if they do not have their first COVID vaccine. They make up around 5% of the workforce who are currently unvaccinated. This policy affects many more beyond in other care settings too. Now, this is a topic which has been discussed for a while, but runs the risk of being ignored with the current circus surrounding the government and the Prime Minister. Whether a healthcare worker should have to be vaccinated against COVID or not is a topic which brings much debate. Now, huge protest happened again last weekend across the country. And before some of you think, guess what, this isn't a topic for me, I don't work for the NHS, so who cares, and you switch off your TV, let me be absolutely clear. The NHS in England has a current backlog of 6 million. That's 6 million of us waiting for healthcare from a system that we have paid for and that should be there to provide us care. Several 100,000 of us have been waiting over a year for that care and still don't have an end in sight. No end to their pain or to their discomfort. And the sudden loss of tens and tens of thousands of staff will not just affect the staff themselves, people who, let's not forget, work night and day in the face of fear, often without protection, to keep us safe, and for whom we once stood and clapped like seals. Be in no doubt, it will affect all of us who need this service. For almost 2 years, the National Health Service became the National COVID Service. Appointments cancelled again and again and again. Now, just as we should be starting to get back to normal, the focus on COVID stands to force a monumental act of self-harm on our care. And it is one that I worry we will never recover from. Some of us will almost certainly lose our lives by the inability to access care. There was at the weekend a suggestion that this whole kind of policy might be delayed, that maybe those workers could stay and see the NHS through a tough winter ahead. How insulting. But the government today have insisted there will be no delays. The policy will still stand. Well, I'm sorry, but this is just not acceptable. And tonight, I stand behind all of those staff that are about to lose their jobs and all of us that are desperately waiting for healthcare. And in doing so, I'm incredibly proud to launch our campaign calling to outdate the mandate, to scrap this policy once and for all. It's worth noting, by the way, that neither Wales, Scotland or Northern Ireland have this policy. And Sajid Javid, there is no shame in reassessing the evidence and moving forward on a different path. Omicron is milder, staff are mainly vaccinated, and so too are most of the vulnerable in our society. And whilst I know many may disagree with me, the NHS must once again return to being the National Health Service and not the National COVID Service. The time is now. Now, I want to know your thoughts on this matter because, as I said, I know it's something that will divide opinion. People will have listened to my sentiment there, and some of you will be shouting at the screen, saying to me, this is wrong, Michelle. You know, if you work in a caring profession, you have a duty to look after those people that you care for. And I understand that sentiment, I really do. But we're in a situation now, as I've just highlighted, where the variant that's circulating is milder. We have many different ways of mitigating risk. We've got testing, we've got PPE, we've got ventilation, and on it goes. But I do want to know your thoughts about what I've just been saying and what I've just been suggesting. And I want you too to try and get behind this campaign if you can. I want to hear your experiences. You can email me on outdatethemandate@gbnews.uk or you can tweet using the hashtag outdatethemandate.